Hello there, Patia. It's Dr. Ian, and today I'm at work at Bangkok Hospital, Patia, not at play as you usually see me. With me is one of our doctors from the Ophthalmology department, Dr. Santar, who is a specialist in glaucoma. Now, some of you may have heard of glaucoma, some of you may not, but it is an important disease. Dr. Santar, tell us a little bit more about glaucoma.
Okay. Glaucoma is a disease that causes the nerve in our eyes to die. And once when the nerves start to die, your vision will start to drop and definitely you can go blind. So that's the importance of glaucoma. There are many risk factors for having glaucoma. One of them is mainly the pressure that's very high in the eye.
Now, you're talking about pressure in the eye itself. Is this in the front of the eye or the back of the eye or whereabouts?
The pressure in the eye is almost as similar to the blood pressure in our body. It's regulated by the flow of the fluid. This fluid, we call it aqueous humor. It's not the tears. It's a fluid inside the eyes which is in the front of the eye.
Mm-hmm. So how does fluid in the front of the eye affect the nerve which is at the back of the eye?
A very interesting question. The fluid in the eye, when the regulation is not normal, either the fluid is produced a lot or it's released from the eye a very small amount. It causes the pressure to be built up into the eye, and the pressure will press every single point in the eye. The most delicate point is the optic nerve, which will slowly die little by little.
Now, when you talk about risk factors for glaucoma, what particular risk factors should we be looking at, or do I have them?
Okay, one of the major risk factors is the eye pressure that's very higher than normal. The second one is the age. We find that when we get older, the fluid production and the fluid outflow, it's altered, it's changed, and it makes the fluid retain in the eye much more. So the incidence increases with age. Apart from the age, a person with very short eyesight, a diabetic patient may have the risk also. And another important one is the family history. If you have one in your family, you should also be aware that you are one of the major risk factors to have glaucoma.
So is glaucoma truly hereditary?
Yes, it is. There are evidence now that are pointing that some genetic points can be transferred from one generation to another generation.
So this increased pressure in the eye is pushing on the optic nerve, and the optic nerve then stops transmission. Does it stop transmission like that, or is it something that happens very slowly and gradually?
Okay, it's a slow progressive disease. So this will take time for the person to have glaucoma before they go blind. It may take up to 10-20 years. We do not know. It depends on the progression. And the early thing is that if we can detect earlier, we can preserve the nerve that we have. So we can prevent the damage that's occurring all the way.
How do you do the detection? Is there some special equipment that you use to show the fact that the person's got glaucoma, or is it a simple test? What is done?
Okay, the major examination that we do is a general eye examination, the optic nerve evaluation, the visual field test, and some special tests that we can do the imaging of the eye. We use the OCT mostly. It's a technical term, but it scans inside the eyes and measures the thickness of the nerve inside our eyes. It's a non-invasive,
Right.
very quick, and it's one of the things that we have over here in the hospital.
I take it you're rather proud of that machine.
I'm very proud. We're the only one that we have it in the eastern area.
Right. Now, what signs does the patient get? You're saying that, all right, this is something that an older person is at risk. Do they get any warning signs to tell them that, hey, better go and have something checked?
Okay, as you mentioned that, I would like to classify into two particular types of glaucoma. One is the chronic and one is the acute. The chronic glaucoma doesn't show any symptom or sign at all. It just only deteriorates little by little. Once when the nerve is damaged at least more than 50%, then you'll have some problems, especially in the peripheral field. So you usually, when you walk around, you usually hit things around your side, either hit the stairs or hit the cupboard or the table around you. Even when you're driving, you may hit the motorcycles that's passing by, usually which we should not be unrecognized by that.
Mind you, hitting motorcycles is fairly easy in Pattaya, Doctor. All right, is there any treatment for glaucoma, or is it just bad luck, you've got it and you're going to go blind?
Okay. Nowadays, it's quite lucky for our patients because the technology in producing the medicine, the lasers, and even the surgical techniques. The glaucoma mainly is that we control the pressure to reduce or prevent the nerve to be damaged. So we can preserve that. So that's what we do mostly, preserve the nerves by lowering the pressure in the eye.
And this is done with tablets or drops or?
Usually we use the drops because it's easy to apply and just directly onto the eye. And if the medication doesn't work, some have to go on to do the surgery. But there is one type of glaucoma, as I mentioned a moment ago, is what we call the acute glaucoma. Usually they have problems with the outflow of the fluid of the eye. We can prevent that by using the laser. So in risk people who has narrow angles or angle closure, we can use laser to cure them. It's the only curable glaucoma that we can do today.
Well, there you are, Pattaya. Just a little brief article about glaucoma. It is something which can strike us all, but it is something which you should check or have checked before it starts to give you symptoms. Sight is very important. Thank you. And thank you, Dr. Santa.
Thank you. ขอบคุณครับ